Hi, my name is Amber. I'm a prospective candidate for a position in your primary care office. I'm an advanced practice registered nurse, specifically a family nurse practitioner. I understand that your practice has not previously employed a nurse practitioner, so let me take the opportunity to tell you a little bit about myself, as well as my profession and some of the benefits of NPs in practice. Nurse practitioners, or NPs, can work in a variety of settings, including acute, ambulatory, and long-term care settings as primary care providers or specialists. As of 2012, approximately 55,000 NPs practice primary care in the U.S. This is roughly 20% of the overall number of primary care providers in the country, including physicians, physician's assistants, and NPs. With an aging population and expanded insurance coverage with the Affordable Care Act creating 9 million newly insured Americans, it is an exciting opportunity and time to be a nurse practitioner. I began my career as a registered nurse specializing in pediatric psych. I chose to become an FNP because I wanted a career in which I could follow my patients through not only acute disease, but also through prevention and chronic disease management. In order to practice as an NP, you must complete a Master's of Science degree in nursing and pass a national certification exam. This program includes advanced courses in pharmacology, pathophysiology, health assessment, and primary care diagnosis and management, just to name a few. Additionally, I've completed hundreds of hours in clinical in adult, family, pediatric, and OB well woman care. I'm trained to work autonomously with patients across the lifespan from birth to death. One of the major issues facing nurse practitioners in the U.S. is that our scope of practice, or how we're able to practice, varies from state to state. Some states allow NPs to work autonomously with full prescriptive rights, while others put unnecessary restrictions on NP practice that prevent NPs from practicing to the full extent of their training. There are currently only 19 states in the District of Columbia that grant full independent practice. This is only about 40% of the states in the U.S. Many states still require antiquated collaborative agreements between NPs and a supervising physician, or restrict the types of medications that an NP can prescribe. Maine is one of the states that grants independent practice, but that being said, there are still restrictions for new nurse practitioners. You should know that in Maine, I am required to have a collaborative agreement in place with a physician or experienced nurse practitioner for my first 2 years of practice. The nurse practitioner's scope of practice, as defined by the American Association of Nurse Practitioners, is as a licensed, independent practitioner who provides nursing and medical services to individuals, families, and groups according to his or her practice specialty. In addition to diagnosing and managing acute, episodic, and chronic illnesses, nurse practitioners emphasize health promotion and disease prevention. Services include ordering, conducting, supervising, and interpreting diagnostic and laboratory tests, prescribing pharmacological agents and non-pharmacologic treatments, and teaching and counseling patients, among others. As licensed independent clinicians, NPs practice autonomously and in collaboration with healthcare professionals and other individuals. They serve as healthcare researchers, interdisciplinary consultants, and patient advocates. The groundbreaking Institute of Medicine report, The Future of Nursing, recommended that nurses, including nurse practitioners, should practice to the full extent of their training and scope of practice. Barriers should be removed. According to Maine law, my scope of practice allows me to obtain a complete health database that includes a health history, physical exam, and screening and diagnostic evaluation, the interpretation of this data to diagnose and treat common diseases, counseling individuals and families, consulting and or collaborating with other healthcare providers and community resources, and referring clients to other healthcare providers and community resources. It is imperative for nurse practitioners to become involved in policy issues that affect our profession so that we can provide the highest quality care possible to our patients and practice to the fullest extent that our training and certification allows. Research supports the idea that professional organization membership promotes independence, power, and identity in nursing, while improving overall patient care. I will be joining the American Association of Nurse Practitioners, the national professional organization for NPs. There are 189,000 nurse practitioners in the U.S. Of these, only 36,000, or about 20%, are members of the AANP. Additionally, I will be joining the Maine Nurse Practitioner Association, where I will join over approximately 1,000 NPs practicing in Maine. There are many important factors influencing what I am looking for in my first NP job, but the following are the most important 3. First, I want to work in a supportive environment in which the other providers, nurses, and staff understand that I am a new grad. It is important to me that I will be able to ask questions, work my way up to a larger panel of patients, and have longer appointment slots initially. Second, I need to be in an organization that allows NPs to sit at the table. I want to be involved in organizational policy meetings, boards, committees, etc. Additionally, I want to take call if my physician colleagues are also taking call. It is important for me to work for an organization that supports me practicing to my fullest extent. Third, I really want to work in a primary care practice, work that sees both children and adults. My training is in family practice, and that is the most attractive setting to me because I enjoy the variety. In addition to these important factors, I'd like my salary and benefits to reflect my contributions to the practice, and I'd like them to be competitive and on par with national averages. The average base salary for NPs according to the Bureau of Labor Statistics is $92,000 per year. The AANP completed a salary survey in 2011 that found the same results, but also factored in other benefits to generate a total salary of $98,000 per year. The average salary for a new grad was $84,500. I am requesting an annual base salary of $80,000 with additional benefits that bring my total salary closer to the national average. I'd like my bonus package to include 4 days of seeing patients with additional time built into my schedule for administrative work and documentation. I'd also like health and dental insurance, paid vacation that accrues, CME reimbursement, retirement options with employer matching, malpractice insurance coverage, and payment of dues and fees for membership to professional organizations. As a new practitioner, I would like to build my patient panel in a stepwise fashion over the period of 9 months to a year. Perhaps I will begin by seeing 8 to 10 patients per day and double that to build an average of 18 patients per day. Additionally, I'd like the opportunity to have a slice of the pie by receiving incentives or productivity bonuses after I've established my patient panel. 31% of respondents to the AANP salary survey reported that they receive incentives or productivity bonuses. The most challenging part of being a new nurse practitioner for me is having the confidence that I can apply all of my knowledge and clinical experiences to my developing independent practice. I'm a well-prepared new NP, and I was a nurse before that. I've had many positive patient encounters and know that my education and clinical experiences have prepared me well. I'm also a young NP at 23 years old, so I'm always a little nervous about how I will be perceived and about being respected by my colleagues and patients. So why should you choose to hire a nurse practitioner, specifically me? My philosophy of care parallels the nursing model of care, which is centered around the idea that care should be holistic. Nurse practitioners like to see the big picture. This means we look at the many factors that make a person an individual first and a patient second. These include the patient's social factors such as family, socioeconomic status, hobbies, interests, work, etc. NPs are really good at figuring out what motivates our patients to make positive health changes, and we're really good at anticipating and navigating roadblocks as well. Research shows that NPs are as effective and in some cases more effective in managing chronic diseases compared with our physician and PA colleagues. NPs focus a lot on preventative care and patient education. One study showed that NPs working with diabetic patients documented that they had provided nutritional counseling and diabetic education in 73% and 57% of their patient encounters, compared to 6.7% and 0% respectively in physician encounters. In this same study, H1C levels were improved in 100% of diabetic patients managed by NPs, compared with 24% of the diabetic patients managed by physicians. This is just one of many research studies that demonstrate NP efficacy and capability. The results of a systematic review of the literature between 1990 and 2008 showed that APRNs, or Advanced Practice Registered Nurses, and physicians had equivalent scores in 13 categories of patient care. APRNs outperformed physicians in 11 categories, and physicians outperformed APRNs in 0 categories. The research supports the efficacy and safety of APRN practice. The Institute of Medicine recommends APRNs practice to their fullest extent, and our patients are satisfied with the care they receive. Let me show you what I can do for your practice and bring my personal and professional strengths to the table.